Substance abuse among the elderly population is a very taboo subject that does not get much attention in our society. During this presentation, I will discuss the types of substance abuse that occurs in this community, diagnosing substance abuse in the elderly, including the symptoms, the cause of this epidemic, and treatment choices for the abusers. The elderly population is currently at almost 40 million in America and growing. With the population growth comes an increase of substance abuse among this community as well. Substance abuse among the elderly community can be broken into two categories: early onset, in which the substance abuse began before the age of 65, and late onset, in which the substance abuse began after the age of 65. Late onset usually occurs when the individual has experienced significant stress in their life, such as the death of a partner. The most common substance abused by this population is alcohol, with prevalence rates ranging from 2.2% to 9.6%, depending on the population sample. The National Institute of Alcohol Abuse and Alcoholism defined at-risk drinking for individuals over 65 years and older as more than one drink per day. Alcohol is processed differently in the body of an older adult than in the body of a younger individual, which makes it more dangerous to the elderly. One reason for this is due to the decrease in body water and slowing of metabolism rates, which result in a lower tolerance to alcohol, quicker intoxication, and alcohol staying in the bloodstream for a longer period of time. Alcohol abuse in the elderly can also have the same effects it does on young adults, but with a more rapid effect. When diagnosing alcohol use disorder in the elderly population, the DSM-5 is used, but this can be problematic due to the change in symptoms elderly individuals experience. For example, tolerance is a major criterion for the disorder, but is not experienced by the elderly. Also, failing to fulfill major obligations would be difficult to apply to an elderly adult since most are retired. The second most common substance abused in the elderly community is prescription drugs, including opiates, benzodiazepines, and muscle relaxers, with prevalence rates as high as 11%. 3 in 10 people between ages 57 and 85 use at least 5 different prescriptions at one time. Hospital admissions related to prescription medications and illicit drug use rose by 96% among people ages 65 to 84. When elderly individuals are admitted into the hospital, their substance abuse issue is often overlooked because the symptoms are often similar to other health issues commonly seen in older individuals. The Center for Substance Abuse Treatment made a list of symptoms to look for in drug abuse in older adults, which includes memory trouble after having a drink or taking a medication, loss of coordination, changing in sleeping habits, unexplained bruises, being unsure of themselves, irritability, sadness, depression, unexplained chronic pain, changes in eating habits, wanting to stay alone for much of the time, failing to bathe or keep clean, having trouble concentrating, difficulty staying in touch with family or friends, and lack of interest in usual activities. As you can see, most of these symptoms are often seen in older adults with other conditions, such as dementia. A few more obvious symptoms of substance abuse are the individual constantly thinking about the drug and fears not being able to function without it, and when an individual starts taking medication at different times and at different doses from what their physician has prescribed. This, along with other factors, contribute to the severe underdiagnosis of the disease in the elderly population. There are physical, psychological, and social factors that make elderly people more vulnerable to addiction, stated Angela Conway of the South Miami Hospital's Addiction Treatment Center. Many older adults get prescription medications due to joint pain, sleeping problems, or injuries from falls. The easy access to prescription drugs and the lack of questioning by doctors has led to this outcome. Mixing alcohol with these prescription drugs can be extremely dangerous. Treating older adults with substance abuse issues can be difficult because approaches that work for young individuals do not always work for older adults. One treatment method that is suggested when working with older individuals is psychoeducational techniques such as interventions, motivational interviews, and cognitive behavioral therapy. Group therapy, such as Alcoholics Anonymous or Narcotics Anonymous, is also useful, but is shown to be most successful when the group is made up of like-aged individuals. Medications can be given to help with withdrawal symptoms. To reduce withdrawal symptoms of alcohol, a 50 milligram dose of an opiate antagonist is sometimes used in older adults, along with psychoeducational methods. There are also medications to help with opiate and nicotine withdrawal. No medication has been approved for treating addiction to marijuana, stimulants, or depressants. Treatment is often long-term for older adults with substance abuse problems. Relapse is also possible, just like any other addict. It is important for the family of the addict to get involved with the rehabilitation of the older adult. Treatment must be tailored to each patient and include medical, mental, environmental, and social problems that are related to the substance abuse problem. The rapidly growing substance abuse problem in the elderly community will continue to grow unless doctors, counselors, and families begin to recognize the symptoms and signs. The need for further research and development of treatment programs is also needed to stop this epidemic.